Hello and good evening. My name is Melinda Herring, and I'm the Deputy Director of the Eurasia Center at the Atlantic Council. We're delighted to have such a large group of people here for an important conversation about the coronavirus in Ukraine. I'm joined by Dr. Alana Soproun, the former Acting Minister of Health of Ukraine. Welcome, Dr. Soproun. It's great to have you here. I'm joined by Yulia Kovalev from the APU, the Deputy Head of the Presidential Administration. Welcome, Yulia. Welcome. And also joined by Andrei Stavnitzer. Welcome back, Andrei. We're thrilled that you can be with us. Andrei is the co-owner of TIS in Yuzhny, Ukraine, and also the coordinator of COVID response in Odessa Oblast. So thank you so much for joining us. I want to turn to Dr. Soproun, who's also a physician, and she's known for her no-nonsense, data-driven approach. Dr. Soproun, can you level with us? How hard will this crisis hit Ukraine? The previous health minister predicted that all pensioners will die. But in your very popular Ukrainska Pravda article, you stated that he was completely wrong. How bad is it going to be?
Well, Ukraine is a bit late in coming into what's happening with the coronavirus. Currently, there's about 549 cases, positive infected patients here in Ukraine. There have been 13 deaths. And 8 people have recovered, so they are testing negative for coronavirus. This is far behind a lot of our neighboring countries, and we've only tested about 2,600 people for the coronavirus with the PCR test, or the test that is the more definitive one. Ukraine has had almost 500,000 people return from outside of Ukraine back into the country, and actually it was from those people that are returning that the coronavirus was brought into the country. And the places that we're seeing the most cases are in Chernivtsi Oblast and also in Kyiv City and Kyiv Oblast. Currently now in Ivano-Frankivsk Oblast and in several of the other Western oblasts, there are now more cases being diagnosed. In Ukraine, we had, as many of you heard, there was a bit of a scandal when the first group of our Ukrainians were returning from China. And what that did was it showed that there's a lack of coordination of communication by government agencies. There's been a lack of this coordination since then, and Ukrainians are getting very mixed messages. So they're a bit confused about what they should do. One of the things that has been a problem is there hasn't been an availability of tests. There were a group of tests that were brought in, the German tests that were brought into Ukraine at the end of February, and the first case was diagnosed on March 3rd. But since then, over an entire month, only 2,500 tests have been done. And it's been a lack of the PCR tests being available here that have caused us to have such a low number of cases. We suspect that there are many more. And just today, we heard that in Ternopil Oblast, there are about 150 people with pneumonia in their hospital. And in the hospital, 1/3 of those people, or 52 of them, tested positive for coronavirus. So there are probably many more cases in Ukraine that just haven't been tested yet. So I think over the next couple of weeks, we'll be seeing a surge of cases. Ukraine has approximately 6,000 ventilators, and that is information that's directly from the head of the Association of Anesthesiologists of Ukraine. So he has spoken to the anesthesiologists in all of the oblasts, and they've told him that there are about 3,000 ventilators in the ICUs and another 3,000 that are in operating rooms that can be used for the patients who need them, who need ventilators. However, for our population of approximately 37 million, that is a pretty low number. Comparatively speaking, Germany has 25,000 ventilators, and they're already ordered 10,000 more of these ventilators. What we hope in Ukraine is that the very severe quarantine measures that were put in place will, as we all talk about, flatten the curve, so that there will not be such a great surge of patients, and that by having the elderly and those with chronic diseases being isolated, that those who are the ones that are more frequently on ventilators and also unfortunately die from the disease, they won't be infected. So in Ukraine, the people who have the highest level of infection are actually between the ages of 20 and 45. The elderly are not as commonly infected, at least from the testing that we've done up to this point. So what we're hoping is that that will not change over time. I think the most important thing that we need to do now is to make a plan and a strategy on how we're going to be moving forward, because we've done a lot of work over the last couple of weeks to prepare our hospitals, to make sure that the physicians are getting the protective equipment that they need, because there was a lack of it here in Ukraine. And also, I think that we need to make a strategy on what we're going to do as we come out of this quarantine, because once we're in the quarantine, we might have a low level of infections because there's not a lot of contact between people as we move out of the quarantine, which we're going to need to do soon because of the economic questions we have in Ukraine. We don't have a very strong economy, and as Yulia, I'm sure, will tell us, there are difficulties in what's happening in Ukraine when it comes to our economy.
Terrific, thank you.
One more issue I just wanted to bring up that's very important is that there's been a lack of coordination between the central and local governments, and it seems as though civil society and businesses, just as in the beginning of the Russian-Ukrainian war, when Russia attacked Ukraine, civil society and businesses came forward and started helping with the needs of the frontline soldiers and the volunteers that were fighting. Currently, the same thing is happening. Our front line is now our medics, our doctors, our nurses, whether they're family physicians or whether they're in the hospitals. And civil society and business has really stepped forward and has been helping quite a bit with getting ventilators, getting equipment to them, because for the first 2 months of the pandemic in the world, the government did not do a very coordinated response. We've had 3 health ministers in the span of 3 weeks. And I think that a lack of leadership at that level is very difficult to be able to coordinate the actions that the Ministry of Health needs to do.
Thank you so much, Dr. Saprun. I think that there's a lot of themes there that we're going to pull on. I want to ask you one more question and then bring Andre and Yulia into the conversation. Last week, Andre spoke with us about the economy and also the coronavirus. And he said that most people were expecting the full force of coronavirus to hit in 3 weeks in Odessa Oblast. When do you expect the full force to hit in Ukraine?
I think that we are already in an epidemic situation. We just haven't identified it yet because we didn't have the number of tests that were necessary to do so. Over the next 2 weeks, we will be seeing an increase in the number of cases. They have now started appearing in all of the oblasts rather than just in the 2 that had the outbreaks that we saw. And I think that those numbers will be rising quite quickly. With the quarantine in place, we're hoping that those numbers will not get to the point where they will overwhelm the healthcare system. However, our healthcare system has been in pretty bad shape for very many years. We're lucky that we have family physicians, and the first stage of healthcare transformation or reform happened, and people have their own family doctor, someone that they can talk to when they get sick that will advise them what to do next. But the hospitals have still not gone through the reform. They're only starting the reform process. So they're the ones that need the most help right now. And most of the volunteer organizations, as well as the local administrations, are concentrating on helping the hospitals to organize themselves. Only 2 days ago, the Ministry of Health released the locations of the hospitals that will be taking COVID-19 patients. That's what I mean by a lack of coordination and quite a bit of holdup when it comes to creating a strategy on what we're going to do when we start seeing these patients. Things are moving forward now, and hopefully the physicians will get the equipment that they need, and the patients will get the information that they need so that they can go to the right physician, go to the right hospital, and get the treatment that they really deserve.
Thanks so much. Andre, when we spoke last week, you said that hospitals are not ready. You were very definitive about that. Has anything improved in a week? Do you have more ventilators, more PPE, more gear? Tell us what's happened in a week, please.
Well, the only things that changed basically are the supplies that are coming thanks to the business community. So we haven't had any help from the state yet. The oblast, the head of the oblast is probably one of the worst appointments of the president, I guess. It was a mistake. So no help from the state. The only supplies that are coming in are the suits that we bought from China, the ventilators that we bought from anywhere we can get, oxygen concentrators and things like this. It's not too much because we don't have too many resources, but it's like we got 5 more ventilators. We got 3,500 suits, and also another 12,000 coming in today. We have 500,000 masks and that sort of stuff. So we keep receiving supplies that we ordered about 2 weeks ago.
Okay.
But the situation hasn't changed. In fact, it has worsened because the employees in the hospitals, they started realizing what's going to happen, and we see a lot of resignations there in some hospitals, up to 50%.
Holy cow.
Yeah, and it's a big problem. And we, as a business community, we started working on a special fund to help these doctors and pay them some extra money for, to stay working, because basically they're not getting enough, even though they're getting double increase from the 1st of April. It's still not going to be enough, and even with this increase, they're still resigning. So we're working on filling this fund for Odessa region. That would be approximately 20 million hryvnias per month, which is not huge. That's about 3,000 medical employees, including only the doctors that deal with COVID.
Okay.
So that's going to be the emergency ambulances. That's going to be the people in the hospitals and the nurses, sort of the doctors and the nurses. And we work on getting this money to them. What else?
Let me ask you about, you wrote a very interesting piece in Nova Vremya, and you said that when the gear arrived from China that you mentioned, that 5 different regional offices were fighting for the gear. So I found your piece really disturbing, and I know other people did as well. Is there more coordination now? Does the coordination need to come from Kiev, or should it be directed on an oblast by oblast level? I know you said that the oblast governor is a disaster in Odessa, but talk to us about a bigger strategy, please.
Yeah, but this is true. I mean, it was a fight between different representatives of different oblasts, and basically today, 2 deputies of the governor have resigned. At least they applied for resignation. I spoke today with Deputy Governor of Dnipropetrovsk, Dnipro, and I understood how important it is to have a good governor. Apparently, they're very lucky. So the guys are doing the same things that we are doing right now. They are doing it for 2 months already. They have huge progress. They have approximately 400 ventilators already. We have only 70. Can you imagine that? They have supplies, they have suits, they had 2 months. They had very decent people working on this with business experience, with business background. And I was really disappointed when I was happy for Dnipro, but obviously unhappy for Odessa when I heard the story that they told me. So we hope something will change. Maybe the president will change the governor. They have spent almost zero of the state funds to get prepared. In comparison with the city, which is doing very good. They have a good team. They do supplies. They buy ventilators. They buy suits. They buy masks. Everything. Today, one of the very famous hospitals in Odessa, Vodnikov, the doctors, the anesthesiologist and reanimatologist, they come up with a video. Maybe you'll see it later on today. Where they say that everything that the government is saying is lies. They have zero supplies. They're completely unprepared. The only things they got is from us, from the volunteers, from business community, and they're not ready to fight COVID in this situation. Our governor continues to issue some crazy orders. For example, as you know, as everywhere, we have lack of tests, and we are not sure how many hundreds or thousands of infected people we have, but he issued an order to for the whole oblast to deliver people with suspicion for pneumonia into rayonny hospitals, so hospitals in rayon, not even special COVID hospitals, but ordinary small hospitals in rayon. And if you have a suspicion for COVID, for pneumonia, that's probably 70-80% it's COVID. So we're going to have a lot of small hospitals, actually 8 more hospitals in rayon with infected doctors. They have nothing there. They don't have ventilators. They don't have suits, nothing. And the ambulances are going to delivering already pneumonia patients over. So it's been a disaster. We spent so much time fighting stupid decisions of the governor rather than working jointly like they do in other cities. And that is really frustrating. That takes a lot of energy.
I can see that you're tired, and I know your team is too. Thank you for all your work. I wanted to ask you one more question, and then we're going to bring Yulia in and move to the economic picture. You talked about a case of fraud in Kharkiv last week. You said that COVID-19 tests were ordered, but the ones that arrived were only tested for the flu. Are you seeing more of this fraud, or are the supplies that you're now receiving what you actually ordered?
We see more fraud all over. So because the whole world is in the queue, in one big queue in China, we see a huge amount of fraud. We see some companies that take money from because now everybody is running around with money. So yeah. they give money to everybody. We see a lot of Chinese companies that take money, they don't send any product back, or they send some fake product, fake masks, or tests that are not for COVID, but for other flus. And we're talking about millions of dollars. And a lot of our efforts we spent on filtering those companies and trying to see who is reliable and who is not. A lot of, we're trying to get more ventilators as everybody. And all of the factories that are now producing decent ventilators, they can confirm an order for you for July and August. July and August is unacceptable. So we try to find somebody who has quotas for earlier. And with these quotas, a lot of companies are running around selling basically air. Mm-hmm. So yes, I urge anybody who's doing public procurement, double check 3 times, 4 times. If you have Chinese partners, look at they have the special insurance register where you can check, for example, how many people are insured in this company. So for example, a company that we thought was a ventilator plant turned out to be just a one-day company with 1 employee. And we see a lot of that. So we have to be very, very careful here.
There's an interesting article that Reuters did yesterday about maybe Ukraine having the ability to make ventilators. There was a state-owned enterprise that used to make them. And I know there's plans, there's specs, but they're incomplete. So are you guys crossing your fingers that Ukraine will be able to make those domestically, or is that going to take too long?
No, we even found a few companies, 2 or 3 companies who are actually doing replicas of those Soviet ventilators.
Okay.
But they are on a very small scale. So they do like 10 ventilators a month. And Igor Gumenny, who is from Ukrainian beer company, and Alex Konotopsky from Ajax, they are now jointly working on scaling those productions for those other guys. Hopefully having them produce hundreds, but it's going to take time, even if we push very hard. But yes, there are companies who are actually producing Soviet-style ventilators, and we just need to help them grow very fast.
Great, thank you. Yulia, let's bring you into the conversation. Thank you so much for joining us. The first 2 weeks of the quarantine put somewhere between 500,000 to 700,000 Ukrainians out of work. And I know that figure could jump by a factor of 5. And there's some other reports that Ukrainians don't have enough money saved beyond a month. Why did the government act so slowly to prepare for the coronavirus? And what are the plans beyond the current quarantine?
So maybe first of all, thank you, Melinda, for inviting. And first of all, I think just to little bit to let on that what Andrei said, just as a few minutes ago, the second plane from China landed in Kyiv, and we brought to Ukraine more than 100,000 of PCR tests and masks and other equipment. And what Andrei was mentioning, and I want to also assure that the whole world is now competing for those test systems and for the medical equipment in China. So we had one of our MPs who was also joining the plane to China, the first plane of China. And the story was that there were just people standing in the queues with cash and competing who first will get the testing system and the equipment. So that there is the whole world there waiting for that equipment, and it's not only Ukraine who felt this shortage. And actually, so the second plane, which landed just a few minutes ago, we will disperse these testing systems and another medical equipment to all of the regions, especially for those who have the urgency need today, where the cases of coronavirus detected are bigger and where there is a lack of this equipment, depending on how quick the governors work, how quick the local communities work, because there is a different level of preparation with the different regions. And we also I would also stress that there is also a big support from all of the business community. Each day we have a hotline with starting from the retailers, ending up with small, big, and very big business of Ukraine. And we're doing it like a 24/7 hotlines. We work all together to support a lot of initiatives, starting from developing now the smart system to track the people who are detected with coronavirus and to track all their contacts. And we have a volunteer IT teams who are now supporting the government of developing these IT projects, ending up with those business like Andrei, who is ready to step in and to support both financially and also providing the teams and coordination centers to support on the local level of working both with the doctors and also on the side of supply of the testing and all of the other equipment. We also, because of the quarantine, there are already the restrictions for the business. So there are a lot of businesses, especially the small and medium businesses, who are now locked down because of quarantine. And for the last 2 weeks, we already first of all, passed the two pieces of legislation that are aimed to support both the small and medium business and also the citizens of Ukraine with the support. The government prepared the budget. Unfortunately, it was not actually yesterday approved, but we are expecting in a few next days to approve the budget, where the government took more than 100 billion hryvnias to the special fund that will be committed to three main issues. One is the support of healthcare system, including the medical equipment, and also support the doctors with much higher salaries in order to support them with and to encourage them to work with COVID patients. The second important thing is the support, social support for those people who are now getting no salaries and who are not working. And that's why we also liberalized a lot all of the labor legislation just yesterday in order to allow a lot of businesses who are now working online and doing the work from home to get rid of those Soviet regulations and to move on of the flexible time. And we also increased and make it much easier for the people to get the social support for unemployment. That now could be done from the first day online, and we extended the support for that people. And the third thing where this fund will be also a support to small and medium business that is suffering from the coronavirus. In parallel, we already cut the expenditures of the budget for more than $1.7 billion. So all of the not very important and not the crucial expenditures which were recently planned at the end of last year for 2020 were already cut. But what is the most important, when you need also to sustain financially health at the country.
Sorry, could you say that?
We also need to have this.
Sorry, could you say that again? It stopped.
Yes, and I think the most important now is to keep the macro stability, and the support from IMF, World Bank, and the other international organizations is crucially important for us. And I think yesterday it was one of the historical day in Parliament. You see that all of the members of the Parliament were wearing masks, where part of them, we have 7 MPs who are now detected coronavirus, but the president himself and all of the MPs were working late nights yesterday, and we voted the land market reform, which is, I think, the historical for our country. And also the Parliament voted very important on the first reading, very important bank law. which is one of the most important prior action to get the new extended program from IMF. So I think that it is a good way and rather quick way on moving to fix the IMF, to fix the other international support, and that will help us to allocate more resources for both the healthcare and the social support for vulnerable people.
Absolutely. Let me ask you, though, on the question of coordination that both Dr. Saprun and Andre have raised. What are plans to increase coordination on an oblast level? Are you guys planning to appoint someone to be the sort of coronavirus czar? Is that something that's under consideration?
Yes, and first of all, we have the coordination center, which is led by president, which meet every day, and they have every day the video call with all of the regions, including both the president, prime minister, healthcare minister and deputy, Mr. Lyashko, who is deputy head of the Minister of Healthcare, and the one who is 24/7 in charge of communication. We have all of our both the defense, the infrastructure minister, because we also had more than 140,000 Ukrainians who we brought back for the last 3 weeks to the country. And that is working on the top on the government level from Kiev every day. This kind of the meetings is all the working days, including this Saturday and Sunday, they have the meetings. There is, of course, there are some issues on the local level, and there are different approach with the different, and of course, it's much depends on the leadership of each of the regions. But I think that the more we are moving on, we see also that more and more regions are becoming, let's say, more experienced in the response of crisis. And we also had discussions with the doctors, both from Italy, both we have a conference call with the doctors from Wuhan, where the epidemic started, to put our doctors in contact and give them more information on how to work with the virus. So that is moving on. We even have a few of the voluntary teams of the top world consulting companies who are supporting us both in developing the economic measures to support the business and also to organize the healthcare system. So we are monitoring it day to day, and frankly speaking, from day to day, we are becoming stronger in that. That we also are learning the lessons how in parallel how the situation is developing.
Thank you so much, Julia. Dr. Saprun and Andre, I'd like you to respond to that. You guys have different unique vantage points. Dr. Saprun from the former Minister of Health, and then Andre is someone who's coordinating aid on the ground. Are you getting enough information? Are Ukrainians getting enough information? And how can the government improve the system that Julia just described? Dr. Saprun, do you want to go first, please?
I'll talk about the communication part of it. When we were at the Ministry of Health, we had developed a very strong communication policy where we would, first of all, tell the truth, which is very important. We wouldn't hide information, and we would tell the people in plain words that can be understood by not somebody who's a healthcare specialist, but for any citizen to understand clear instructions on what they should do. And for the first couple of months, there was very little instruction given, either from the Ministry of Health nor from the Cabinet of Ministers, and the President also did not start communicating to the people until very recently. Ukrainians were confused, and when there is a vacuum, that's when disinformation and manipulation can come in and start telling people not the right thing to do. So very early on, people started believing in myths and in disinformation and lies that were being poured into the system, into whether it's social media or whether it was on television. And it made it very difficult to then pull all of that back and try to get the truth out to the people. For instance, for the longest time, we weren't being told how many tests were done, where are the tests, and we still don't know where the tests are. Yulia just talked about the second airplane that came in from China. There's no report of where the equipment from the first plane went to? What oblasty did they go to? Who has them? How come the physicians, as Andriy was saying, how come the physicians aren't getting them? Where is it being delivered? We're not seeing that. It would be much better if there was, say, one website where you can come on and you can take a look at a dashboard and you see there 100,000 tests came in from China. They were delivered to these oblasti into these facilities so that people trust that what's being brought into the country is actually being used for the good of the people. Another thing that would be very helpful is to have very clear instruction and to have a single person or a small group of people who communicate and give those instructions out. What's happened is because of the lack of communication over the last couple of months, many oblasts are doing their own communication and they are creating their own algorithms and they're doing their own, as Andriy was saying in Dnipro, there's also a couple of really good people, Natalia Husak in Chernivtsi, where one of the outbreaks is happening right now. They 2 weeks ago already started that they were testing patients, and they've managed to stabilize the number of patients that are being tested positive. Then in Lviv, Andriy Sadovy, the mayor of Lviv and Lvivska Oblast, has also organized themselves. They went to business and they bought quite a large number of tests, and they're going to start testing the vast majority of the population, anybody with symptoms or anybody who has had contact with people with symptoms. And because of the lack of coordination from the national government, the local governments are now left on their own. So I would advise the presidential office, as well as the cabinet of ministers and the Ministry of Health, to coordinate their messaging, come up with a way where the information that they're putting out is getting to the people, and to also be much more agile in responding to the needs, answering the questions and putting information out in such a way that it's easily understandable to the people of Ukraine. I think that would be very helpful. I think Andriy probably has a lot to say about that communication as well.
Thank you, Dr. Liana. I spoke to the new Minister of Health, and he told me that the previous minister did not even have a clue of what the hospitals are in need of. What are they lacking? So they didn't have like a bloody Google document to see what is needed. So apparently, Liana, he's going to start with this part and make, at least for himself, for the ministry, something agile that changes every day with the supplies. That will include also business community supplies, volunteers, and governmental supplies, and hopefully they will make it public as well. At least I support the appointment of this new minister, because he's been governor to Odessa and he knows Odessa very well. He knows all the hospitals, all the doctors. He's done quite some job, so I'm more or less happy with him being there. The other thing that we discuss at the moment for the doctors on the ground, apart from paying them extra salaries, we talk about insurance, and we talk about different insurance companies, because these people, if we want their families to let them go to work every morning, they got to be sure that if something happens, they will get maybe, I don't know, 500,000 or 1 million hryvnias for their kids. I mean, that's quite important. And the last thing is that we are now applying, hopefully, to the president and to the prime minister. We're going to make those additional payments for the doctors, but as business community. But we're not very happy paying taxes of this money. So obviously we will start doing it with our current profits, and that's important to do it as soon as possible. Otherwise, these people will run away. But in a couple of weeks' time, we hope that Ministry of Finance or the president or the prime minister can react to this and somehow clear this money of taxes, because it makes no sense if we support the doctors directly and we pay, I don't know, 40% taxes on top of it. We could have been doing much more than we are. That's pretty much it.
That's a great point. Back to Dr. Soproun for a minute. Dr. Soproun, we have a new health minister as of yesterday. Will he be any more competent than the previous one? And would you consider becoming health minister again if President Zelensky asked you?
Well, first of all, the Ministry of Health is not the only one responsible for the counteracting the coronavirus. It's actually a joint effort, a joint responsibility of the Ministry of Health, the Ministry of Finance, the Ministry of Internal Affairs, Ministry of Economy, Ministry of Foreign Affairs, as well as the entire cabinet, the presidential office, parliament, and very, very importantly, coordination with local governments, both at the level of the oblast and at the level of the cities. So changing a single person in that entire group will probably not make that big of a difference. So it needs to be coordinated amongst all of these different agencies. And as I wrote in my Ukrainska Pravda article, if the president allowed me to form the entire government, then perhaps I would find those people that would be well coordinated to be able to respond. It is a little late in the game. We should have done a lot more up until this point. And as I sat with my and spoke with my deputy ministers that had worked with me in the past and the people that had been in the ministry, we had laid out a plan of what we would do as this was happening. We were writing about it and we were sending it along to those people that we hoped would listen. But instead, the choices were made the way that they were made. When it comes to the new minister, I think that is a better question to ask Yulia Kovalyov, because the president is the one who is pretty much giving in the candidates for all of these different offices, and they know better what qualities in this new minister they are looking for or they've seen to help him, to have him be appointed at this point in the middle of a pandemic, the third minister in 3 weeks.
Yulia, over to you.
Yes, I here would like to step in that in parallel with the big challenge of coronavirus. We also, starting from the 1st of April, the second stage of the healthcare reform is going to start. And of course, there was a big discussion whether we are ready to, in parallel, also to reshuffle all the system, how the municipal and state-owned hospitals will be financed starting from the 1st of April. And in the challenge of coronavirus, it's quite not easy to proceed with two things. And actually, I will even say that the story from my hometown, Ivano-Frankivsk, in the western region, where there are a lot of cases now detected from coronavirus. And I've heard from doctors, which are the friends of my parents who are living there. There are a lot of problems with the implementing of the second phase of the healthcare reform. There are not all the contracts, not all the packages with the clinics are being contracted and so on. But even with this, the decision to proceed with the healthcare reform was made. And I think for the minister now, the most important thing is the minister is not the one who needs to cure the people. The minister needs to organize the process, both the second stage of the healthcare reform and the more important, the fight with coronavirus. That need to have a lot of managerial skills. And I think the current minister, which was appointed yesterday, first of all, he is a good manager. That's what we need now in order to address the issues with delivering tests, with organizing also the local authorities, with working together with the national healthcare agency, who is now being finalized to contract all of the system, the second piece of the reform, all of these municipal hospitals. We also made a decision, not me, but the government, is to not to step in bureaucracy with the second phase of the healthcare reform, because we heard from a lot of doctors, especially the ones who are working on the east regions just close to the border of the rebel areas, that the doctors were afraid that they need to fill in thousands of papers and a lot of bureaucracy to get the money from the state for the provided services. And it was a lot deregulated. So the doctors now, we are now communicating with particular doctors on the local level, not to be afraid to work within the new rules, which we will start from the 1st of April. But let's be clear, there will be the issues. There will be both the issues with the implementation of the healthcare reform and management of COVID crisis. The thing and the big challenge for the minister is to well manage the system, to understand what the regions need, what are the issues, and be able to make quick decisions. There could be some mistakes, but it's usually better to make 10 decisions, out of them 7 will be right and to have some mistakes instead of not making any decisions. That the challenge.
Hold on a second. Stop for a sec. Why are you guys trying to do healthcare reform and manage COVID at the same time? Are you, given the state of the hospitals that has been described, the state of the poor communication, the lack of gear, the lack of ventilators, does it really make sense to be trying to overhaul the healthcare system and crack down on an epidemic at the same time?
The situation we face now, that it will take much more time now to stop the reform and to reshuffle all the system of budgeting on the contracts and so on. So it's easier now to see it, and we found the solution on how to proceed with some temporary decisions and so on, instead of just stop the system, redo all of the budgeting system. We cannot now go back, and
Okay.
that's actually the biggest challenge. And I think that what I hear with Andriy, we are on the same page, that we believe that the newly appointed minister will be able to lead both those challenges. And I think we have also a good team in the healthcare agency that is dealing with all of the contracting with all of the hospitals, and with the big support of the local mayors and the local communities, we hope we'll proceed with that.
If I may just top up
Yes, please.
What Julia is saying, that we might be lucky with some professionals, but the situation at the moment is as follows: that people are afraid. And if you ask me at this time, would I go for a more professional person or a more decisive person, a more kind of leadership person? I would pick the second, because in the time of frustration and disorientation, when we see it in Odessa, every head of hospital is trying to push responsibility to somebody else, not to become COVID hospital, and also the regional heads of Oblzdrav are afraid, and that I can understand them. That we are facing something horrible, with nobody has done it before. But even at this difficult times, decisions still have to be made. They might be not optimal, but they have to be made, and we need strong leadership at the moment. Even if these decisions might be shallow or too tactic or too short-minded, or not very strategic, we still have to have them, and that's the problem that we have here. I assume it's the same in many other regions in Ukraine.
If I could comment also.
Please.
Well, first of all, I agree. We need to have somebody who's a strong leader to come in and make those decisions. But a strong leader is also somebody that's not always just making the decisions, but they listen to the advice of experts and expertise, people who have experience of this in the past. And that's been one of the problems in all of the ministries since there's been a re-election, is that there hasn't been enough use of the knowledge that has accumulated over the last few years in government. That's number one. So somebody who needs to be open to listen to advice of experts, and those experts should be the ones that are actually on the front lines right now fighting the coronavirus. Secondly, we need to have a clear path, clear direction. And I agree with Andriy that that's something that's very necessary right now. It hasn't been happening, and people are confused. They're scared and confused. And then the third comment I wanted to make is about the healthcare reform. Melinda, this is a second phase of the healthcare reform that started when we were at the ministry. And the financing and what's happening is very much in the background of what the front line of actually treating patients. It's the way the financing will be coming in. If anything, it'll be improved because the National Health Service of Ukraine no longer requires paperwork. They do everything through electronic systems. And so as much as possible, they've been trying to cut back on what it is. The National Health Service of Ukraine is a strong institution that has professional people working. They'll make sure that the financing will come in, and the government has allocated additional or will be allocating additional funds to those hospitals that are treating COVID-19 patients so that they make sure that they have enough financing even through the changes that are happening in the healthcare transformation. So it's a continuation of a process that's been going on for, this is already the third year. So to put it off for some period of time is not really necessary because all of the groundwork has been done up until now. There has been a bit of a problem over the last, say, 6 months after the leadership at the Ministry of Health changed. Things weren't moving forward as quickly as we would have liked to see it when it comes to the healthcare reform, but the system really is pretty much ready for moving forward. And I think that the increased financing that will come to those hospitals that have the most patients will be helpful. For instance, I even got a telephone call a couple of days ago from one of the hospitals that will be one of the frontline hospitals. It's one of the head doctors called and asked where they can buy a ventilator because they are getting next month, they're getting additional 5 million hryvnia in their regular budget for the amount of services they will be expected to provide for patients. And now that they have extra funding, they want to make sure they're investing it in that equipment that is most necessary. So I think that the healthcare reform isn't going to necessarily be a problem. Right now, we need to talk about making a strategy on how to move forward, having good, strong leadership moving forward when it comes to the response to coronavirus, and also making sure that there's protection for our healthcare workers, whether it's personal protective equipment, whether it's, as Andriy was saying, insurance, and also support. Because, say, doctors, nurses, they're working in the hospitals, their families need help as well. We keep talking about how we help the families of the soldiers at the front lines. We should also think about helping not only the physicians and their and the nurses, but also the families that won't be seeing them as often and will need emotional as well as physical support. So a lot of programs are now being organized to help the medics get to work on time, to help their families. And I think that that's a really important part of what can help them stay on their jobs, because they'll feel as though their families will be protected in case something happens to them.
Thank you, Dr. Saprun. Those are all really important points. And thank you for responding to the reform question as well. I was struck by something you said about using open language that people can understand. And I've been watching Andre as he's stepped into this new role that he never sought, communicate with people. And he's been brilliant on Facebook. He's been using ordinary language and posting pictures and talking to people and explaining what's going on. Andre, this is the last question for you, and then I'm going to bring our audience in. What tools are you using beyond Facebook, and are people taking the guidance to self-isolate seriously, and are you self-isolating?
We have a whole PR department. It's not a department, it's basically an amount of volunteers who are in the same group, basically gathering information from all over the world. We have a few doctors from Italy, from New York, and from Ukraine, and they keep feeding this group with different articles and Facebook posts. And there are volunteer translators who translate that into Ukrainian. And we have a Telegram channel with already, I think, 6,000 people over 4 or 5 days, where we post every news on the subject, especially from the region, of course, but also from all over the world. We use local TV broadcasting, radio. Every hour, they keep telling people, please go home, please stay home, don't leave, and so on and so on. To my shame, it's not working too well. Odessa over the weekend was warm, and there were thousands of people by the sea, self-isolating in queues for hot dogs. And despite all the efforts of municipal power, they were going around with police cars with loudspeakers on the top, telling people to go home, to self-isolate, and so on. That does not help. Unfortunately, there are kids on the playgrounds. I really don't know how to get it to them. I think they will only start hearing it when we will have a few hundred dead people in the hospitals, and somebody they know will actually pass away. This is the only chance how to get through, because we see also in Kiev, Obolon, riverbank was completely occupied by people walking and talking and so on, not wearing even masks. So it's it's one of the biggest fails. But I guess it's not only our mentality. It's we have that, we see that in Spain, we saw that in Italy. I think for Ukraine at the moment, it would be a good idea to implement how do you call it? Чрезвычайная ситуация. Uliana, how do you?
Emergency situation.
Emergency situation, and to have people actually pushed from the streets. I think that would make sense. Also, I keep quoting this Vietnam case. I don't know if anybody read about it. Vietnam has 180 or 190 people infected, 0 death or 1 death, I believe. Because at a certain point they started isolating everybody who was coming into the country with special camps, and it worked out perfectly. And we also started the Sanjari case, and we should have continued in this way. Then maybe we would be much safer right now. But as Uliana said, we have no tests, and nobody can tell. Apparently, we're talking about tens of thousands of infected people already all over the country. We see a lot of pneumonia in Odessa Oblast. Again, no tests yet. So,
okay.
I wanted to comment a little bit also, one last thing about how certain countries have reacted. One of the issues that has happened from the very beginning is that China didn't tell the truth. China didn't reveal to the world that there was a virus that was causing pneumonia. Even in the beginning of January, the WHO, based on information from China, was saying that there is no human-to-human transmission, when China knew very well that there was human-to-human transmission. So we could have, as with Ebola and with several other outbreaks, we could very well have possibly contained it within China, within one province, if they would have reacted properly. There are a lot of other countries that are also lying about how many cases they have, or they're just not testing. And I wouldn't necessarily, the authoritarian countries that are giving us statistics, I wouldn't necessarily rely on them. It's better to look at statistics from places like Germany that is testing a lot of people. They were the ones who actually did the best job when it came to identifying those people that were coming back from out of the country. They didn't just isolate them. They told them what to do, self-isolation, what it means. They tested them, and then they tested all their contacts. So what they've had is a large number of identified positive tests or infected, but a very small number of deaths and a small number of people who have severe problems. So I think that that's the better way of doing it. And I differ in the opinion that I think that it's a threat to our rights, our human rights, and our rights as citizens to lock everybody up who's coming in from out of the country. I think the biggest problem is that people weren't told in Ukraine what it means to self-isolate and what does it mean to be under quarantine. In Ukraine, when people came home from Italy and they were told to self-isolate, they said, oh, I have to stay home. So then they invited the entire village to their home to welcome them. And the village got sick. It needs to be explained very clearly. And we've been trying to do that on the communication that we've been doing, and it hasn't been clear enough from the official communication from the government. What does it mean to self-isolate? What does it mean that you're under quarantine? What does that mean to not go out and have barbecues with 50 people, but you can go for a walk on the street? The information just isn't out there, and it isn't being given in such a way that people understand it. And unfortunately, most of our television stations are hyping on this. They're not giving accurate information. And most of our stations are oligarch owned, and what they're hoping for is chaos in the country rather than a response that is planned strategically, tactically, with good leadership and good information and good communication skills.
Liana, let me disagree with you on this, because maybe on the national level, Melinda, conflict is great on.
Absolutely, go for it, Andre, please.
Yeah, that's what I thought. Conflict, основа драматургии. That's what they say. It's the foundation of drama. So maybe nationwide, you're right about the oligarchs and the TV channels, but we did our best for Odessa, for all regional TV channels and radios it was going on rotation hourly, all the time. We even have invited local opinion makers, celebrities of different age groups, especially the elderly people, and so on and so on. So we were really pushing hard and telling them what is self-isolation, what does quarantine mean, how to do it, what to do about parents, relatives, kids, and everything. We were very, very pushy and precise and very informative, and it did not help. So I assume it's also a part of national culture. It happens elsewhere, Italy, Germany, whatever, Spain. It's not gonna be the case with us. We're blessed with God or whatever. We're not gonna be hit by coronavirus. Sorry.
And here I would also, Melinda, step in and say that we usually, I agree that communication matters, and the way we communicate and how we communicate is also important. But I think it's not enough. So what Andrei said, and we already are communicating, and the president, the prime minister are doing each day the communication with all of the Ukrainians, both stressing on self-isolation and both just informing the society of how the situation is developing and what steps the authorities are taking. But the second thing is, I think it as much as important. We can communicate of self-isolation, but we need also to work on getting the tests, just physically bringing them to Ukraine, where I think we have a good cooperation with all of the business community and state authorities. We need to have all of the needed medical equipment, because without that, whatever the communication is, we need to test the people, and we need to have the equipment that will save the lives. So that is as much important as the communication. And unfortunately, I here agree with Andrei. Whatever the communication is, we still have a lot of people on the streets. We still have a lot of children and elderly people in the supermarkets. We still have a lot of, I think, not responsible parents bringing their children a lot of entertainment and so on. And that I think we all need to show by examples, and that's the only thing we can do. We need to care and persuade, starting from our family, starting from our parents, starting from our friends, and that's how it can work. I think that here there is like not the limit of how much we can communicate, but we need still to have a day to work also, to work on getting equipment, to work on protecting doctors, to work on starting the second phase of the healthcare reform. And the team of people, both in the government and the local authorities, is a bit limited as usual. And the third thing, which we all need to consider, nobody was ready for coronavirus, both on the healthcare system and the economy. Like everybody, look on the few months ago, the global GDP prediction for 2020 was around 3.2. Now all the analysts are forecasting the global recession. The Ukrainian government, look on the October, we were predicting 3.5 of GDP growth, increase of salaries, increase of jobs, and everything was much better than we all face today. Nobody predicted the oil prices around $30 globally. That's the black swan we all are facing, and we need to react jointly. We need to take advice and take the efforts both from civil society, the government, the local authorities. I recall the situation in 2014 when the war began, and I think the mobilization of all of this is not the time to just to compete on ideas, to compete on the leadership. That's really the time to unite all the people together to win this battle.
Well said, Yulia. I'd like to turn to Dr. Saprun. Dr. Saprun, you have a question from Taras. He wants to know, how can you advise against mass use of face masks when there's clear evidence from South Korea, Singapore, Hong Kong, and Japan where face masks are normalized and infection rates are much lower? Even if there is no clear evidence for the mask specifically, isn't it an overreaction and use of all possible precautions a reasonable approach under these circumstances?
Ukraine doesn't have enough surgical masks and respirators for our healthcare personnel. So from the very beginning, I have been talking about the fact that we should have these masks available for our medical personnel first. The second group of people who need to have those masks are the people who are sick with coronavirus so that they don't infect other people. Then the next group of people who need the masks are those that work in places where they have a lot of contact with a large number of people, say those that are in post office or working in as cashiers in stores where there's a lot of strangers coming in. Then what's left over can be used in whatever manner it needs to be used. So if you are in a closed room with a group of people that you're unfamiliar with, wearing a mask is necessary. If, however, you're walking on the street in the open air and you're not meeting up with people closer than 2 meters from each other, you don't need to wear a mask. What many people do is the mask has become like some sort of a talisman for them, some sort of lucky charm that if they have a mask, they're not going to get sick. Whereas we know that surgical masks, the only way that you can use them properly, surgical masks, are if you change them every 2 to 3 hours and you wear them properly. Same thing with respirators. Now, the respirators definitely should be used only in healthcare facilities. There's absolutely no reason to use them in any other facility. And I see people walking on the street and riding their bike in respirators. So the education of when it's proper to wear a mask, how to wear a mask, and who needs them first is what we're concentrating on. What happens is people hear something different than what's written or what's said. They hear, I'm telling them not to wear a mask. No, I'm telling them to prioritize. As anybody can tell you, of course, we should buy ventilators and give them to those hospitals where COVID-19 patients will be treated, not buy a ventilator and give it to some small local hospital that will never see one of those patients. We should prioritize and give it to those people who need it most. So that's the story about the masks. And there's been a great deal of misunderstanding. Then I'm not even going to go into very details about Ukrainians making homemade masks out of regular material, which of course allows sneezes, viruses, and so on to go through because material has holes in it. It isn't completely sealed off from the size of particles that are included, or that we have the size of particles that viruses are. And once a mask gets wet, then anything can move through it. So homemade masks are, again, very limited use. They can be used, but don't expect that they're really going to protect you that much. If you want to wear one, go ahead, but don't fool yourself into thinking that you're protected 100% because you have a homemade mask on.
Great, thank you, Dr. Saprun. A question for Andre. Andre, this is from Richard. He wants to know, are you talking about a lack of planning, or are you suggesting that equipment is going missing when we were talking about fraud?
No, I'm not suggesting it's going missing. There is lack of reporting. We have no clue where it's going and who is receiving it, how much to each oblast, to each rayon. If you talk about governmental stuff. For example, I just found out that the governor of Odessa the only thing he's spent 7 million hryvnias in the last 3 weeks. The only payment that he's done is 7 million hryvnias to Odessa Oblast hospital, which is not receiving COVID patients until the wave 3. I'm asking, what the hell are you doing? Why are you supplying stuff, medical equipment and medications to the hospital, which is not taking part in the COVID? I have no clue. We have 8 other hospitals that have zero stuff from the state, and he's buying something to one of the most modern hospitals. So that's what I'm saying. They don't report to anybody. They don't say what they buy, how much they are paying, and what for.
Got it. Thank you. Yulia, I have a question for you, several questions. This is from Natalie Uresco. To what extent is the extra spending in the budget proposal you described already agreed and enabled in the negotiations with the IMF on the new support? What level of budget deficit will be acceptable under the special circumstances within the new program?
So the draft of the budget that was submitted to the Parliament on Sunday or Monday morning was actually agreed in terms of the total balance with the IMF. So we cut the spendings, as I mentioned, 1.6, $1.6 billion plus having this special fund for so-called coronavirus fund, and all of this, including the new macro forecast where we have GDP decline for 2020 was agreed with IMF, and increasing deficit of the budget. So instead of 2%, what was initially planned at the end of 2019, and also agreed with IMF, now the range is about 7.5% of GDP deficit, which is also in line with the IMF. So we are now in the permanent discussions, very operational one with the IMF team, and moving rather quickly. So there is only one more thing pending, which is the budget and the second reading for the banking law. And I think the new Minister of Finance within the first days in his cabinet is already in communication both with the IMF and the World Bank team. So that's where we are, and we are coordinating with IMF all of these budget discussions.
Great, thank you. Another question for you, Yulia. This is from Eric Hans at Site. He says, what steps has the government taken to allow the business community to contribute without fear of retribution from authorities? And here's his example. He says, for example, Spirit has a monopoly on alcohol production, but other firms can produce to make hand sanitizer, but they can't do so.
We just for that and for that reasons. So first of all, we are now in the 24/7 contact with all of the major business associations. We are like putting it, let's call it a hotline, or what is more popular now in Ukraine, the WhatsApp group, where we are just asking from all of the business associations their proposals, the issues that the companies are facing now, and trying to respond rather quickly. In terms of, for example, the case of all of these sanitizers and the Spirit, who is the state monopoly, yesterday the parliament already voted the law that allows not only the Spirit, but all of the other producers to produce the sanitizer more quickly, to liberalize that sector. And since it will be signed, I think within a few hours by the president, that will go into action, and that will be that's how we react. The same thing with other industries, including SMEs, including, for example, the rent. We have a lot of small and medium business who are like restaurants, cafes, small shops, and the other stuff. And according to the law, we are allowed to postpone all of the lease payments for them in order not to bring them to insolvency, also to do these credit holidays for small and medium business. And here we are working with the National Bank and the instruments and further instrument to support business with liquidity on this quarantine period.
Great, thank you. Andre, this is a niche question, but I think you'll probably know it. Tom Firestone wants to know, do you know if the courts and judicial system are continuing to function, or have they been closed?
No, I have no idea. I would assume they continue to function in somehow.
Julia or Dr. Saprun, do you know the answer to that question?
I'm sorry, can you repeat the question?
Are the courts and the judicial system still working, or have they been closed?
Yes, they are. Yes, they are. And there were there's several changes that are proposed to the manner in which they will be working. It's going to be done with much smaller groups of people. There won't be as many people allowed into the court system, but there actually were changes that were put into the laws right now, so that the much more can be done as we are speaking online rather than physically in court, but they are still working. That's one of the issues that's a problem, is that both the law enforcement agencies as well as the courts are continuing to work, whereas the people are being told to stay at home. So if there is any sort of an issue where civil society would like to make a statement, which often happens by having a group meeting or people coming out and protesting at the courts, they're not allowed to do so. And if they would try to do so, they actually will be ticketed for having done so. So it's we're keeping a close eye on what's happening in general in the system, because now there's a new general prosecutor. There's cases being brought, say, there was several videos that came out about Andriy Yermak and his brother. And there are now cases being brought against the deputy who released those videos by both the State Security Service of Ukraine and the DBR, which is, in my eyes, it seems to me, certainly it's an abuse of power. Instead of bringing a case against the people who are colluding on the video on selling positions at the oblast level and at the national level, they're actually bringing cases against the deputy who showed the videos publicly. We need to be very careful that our rights are not abused at this point, because unfortunately, when pandemics or any kind of situations like this happen, you can turn a country into a police state. And we know what it was like having a police state in Ukraine before the Euromaidan revolution, when the previous president was kicked out of the country for just having done that.
Thank you. That's an important reminder. Yulia, this is probably the most important question we've asked you. So one of our, Richard wants to know about the IMF. Everyone is waiting for the Rada to pass land reform and bank reform. And it looks like the bank reform bill is enough to satisfy the IMF. But what about the land reform? Is the IMF satisfied with that?
We already sent the law which was adopted to and informed the IMF and the World Bank about the structure of that law. If we are talking about the World Bank, we also need, as a package, to vote additional, let's call it supplementary legislation, to allow the land market to implement. And I think we are comfortable with the IMF on supporting the land market reform adopted. However, there are some members of the parliament who already are trying to block president from signing the land market law, because they already issued some postanovas, which is the draft decrees of the parliament to cancel yesterday's voting. That is now the usual stuff when the opposition wants to block the president of signing the legislation. If we are talking about the banking law, it's already passed the first reading, and the parliament supported the quick preparation for the second reading of the law. So by the beginning of the next week, there will be the deadline for the MPs to provide their amendments also on that, and we hope we can proceed then next week with the banking law as well. So here in parallel, we are also finalizing the text of our memorandum, which is usually called the staff level agreement, because the new Minister of Finance and the Prime Minister need to finalize that, but that is more the technical stuff. So we are on the very close edge of finalizing, then signing and getting the IMF board to approve the program.
Wonderful. We are all hoping, we all have our fingers crossed for you. That the law will go through next week. It's time for us to close, but before we do, I'd like to thank all of you for being here. Dr. Suprun, Yulia, and Andre, I'd like to ask the three of you to please give us a few NGOs to watch, and if we want to donate some money, you have a lot of friends of Ukraine in the United States and in Canada who would like to be helping. We hear these figures, we see pictures, we want to do something to help. Which NGOs should we trust? Dr. Suprun, if you could give us a few recommendations, we'd be very grateful.
Well, right now, I'm supporting the Patients of Ukraine, which, Melinda, you know them. Oля Stefanishna, who was the deputy minister, now she's a member of parliament, had founded an organization a few years ago, Patients of Ukraine, and they are working with the individual hospitals, not only here in Kyiv, but throughout Ukraine, in providing the equipment that's needed for those particular hospitals. So Patients of Ukraine, the NGO, has created a separate website, and it's their COVID-19 website. And you can either give a donation, or you can provide equipment if it's a business that can procure something. There's also a place where you can sign up as a volunteer, and that volunteer doesn't necessarily have to physically be here, because some of the volunteers can just share and promote truthful information, can make sure that keep in touch constantly with the people who need to be kept in touch with, and make sure that people are getting information other than possibly the disinformation and manipulation that they're hearing in many other places. And it's important to keep in touch with your acquaintances and friends that you have in Ukraine, find out what's happening, support them in any way possible. And as in most countries that are now in this quarantine mode, many people are sitting at home, and they have time. We don't want them to waste their time. We'd like them to be useful. And if there is fear and panic, that is wasted energy. Let's direct and focus that energy into something useful. And secondly, let's also make sure that we're not sitting and just watching television or reading social media all day, which of course has a lot of hype and a lot of manipulation and disinformation. And instead, let's make sure we keep our social contacts, because I'm worried that what's happening now is, say, as you walk the streets of Kyiv, people look at each other with suspicion and they try to keep a distance from each other. They're not as friendly as they were before. They don't speak to you and they don't reach out even with their voices. And this is a big problem. I think that we're going to have we're going to need a road back to come back into this socialization. So let's keep speaking to each other, whether it's online, whether it's on telephone, whether it's on the street from a distance of 2 meters, but let's not forget that we're humans and we need that human contact, and we're a social species, and we need to continue to interact in society.
Thank you, Dr. Stepan. That's a beautiful reminder. Andre, where should we be turning to help?
The organization that I support and that is based in Odessa, it's called Monsters Corporation. We have a lot of different directions. So we do this COVID hospital support. We buy suits, respirators, gloves, ventilators, and so on. We also do about 5,000 senior citizens that we deliver food and products. So it's pretty much the same as Uliana said. You can help with whichever energy you have. You can either supply food, you can be a call center specialist, you can send money, you can help looking for equipment worldwide. Also, as you know, I'm on the board of Aspen Institute in Ukraine, and we are gathering a list of initiatives that we support and we trust as Aspen Institute, that we check. And I'll be happy to forward it to you, so maybe you can publish it as well. Something that has been screened and verified for basically Aspen alumni.
Absolutely. Thank you, Andre. And Yulia, I'm going to give you the last word. We have only 1 minute left. Is there anything that Ukraine's Western friends, including governments, can do to help you guys right now?
First of all, what Andrea already said, the Aspen Kyiv is doing a lot of efforts and will publish their information. I personally support for years Tabletочки, which also have a separate package. And the third important thing is the help of those Ukrainians who live abroad and because of coronavirus and the recession will left their jobs or feel the lack of financial support to come back home, or they stuck somewhere abroad. So those Ukrainians, we need to take care of all of the Ukrainians and those who are now abroad, and that you can also contact our embassies throughout the US, Canada, or abroad, and also to support those part of Ukrainians.
Thank you all so very much for being here. Thank you for your important work. Keep it up. We're here, we'll be watching, and I'm sure we will have another discussion about this important topic soon. Thank you so much. Good evening.
Thank you.
Thank you.